Okay, so you want to go into the abdominal. You want to stay away from
You were helping
the rectal area, so because you don't need that part yet. Okay, so you got your initial incision. So now you literally, you don't want to cut through anything. So you want to start using your blade to do this. And cut along the side of this so you don't cut it. And then start using your pickups and lifting this up to see what you're cutting into. So no more going straight down. You did your initial. Now work this along the side and retract and see where you're going. Right. You're not going right down to where you need to be. Try to cut along the side and then go in layers.
Like whenever you're scanning something, anything like that, you see how open so you got your skin here and this right here. You see that almost looks like that.
The same thing with you now. So when you did your initial cut, now you want to kind of start using pickups and you want to cut along the side of this. Use this as your guideline so you don't cut right through something. And then just go down deeper and deeper until you see the organs. But if you do it right, you shouldn't have a cut through an organ.
Okay.
So it's not not just going straight down. Try to go down in layers.
Yeah.
Okay, perfect. See how she's cutting along the sides? You're getting to the same spot, but you're not going to be cutting through things. You got it.
Using your index and thumb, but flip, so you can use your middle finger.
Just broke off.
You got a dull blade surgeon? If you do, ask your assistant to change a blade. You can ask for a blade change anytime you think you do. Good. You got better control. That's good. So instead of using your finger, surgery, try to use pickups and pull back. If there's a retractor here, try to, because you're going to be assisting sometimes and having somebody do the surgeon cutting. So try to get used to using more instruments and less fingers. Perfect. Wow. This is really good.
Okay.
And see how you're cutting along the margin? That's what I want, like you're doing. I don't want you to just go straight in and dig out something. Because if there's a suture cut in here, then you did it wrong. Perfect. Because one of the two down, you're going to be skinning this pig. So that means that you're going to have to cut. You're going to have to cut that way. You got it. You're holding, but you know what? Is this how you normally would hold? Hold it like a pencil. And as you hold like a pencil, cut along the side of this so you can see where you're going with it. So get used to holding like a pencil. And hold it right up against the margin there so you know what you're cutting into. Good. You're nervous? You're shaking a little bit.
I am nervous.
Oh.
Right.
Don't worry.
Do you need to call for an assistant? Call it, doctor. Call it.
I don't know.
Dead.
1022.
Oh, look at this group.
I know this one's
What is that green thing?
aspirated some things.
Can I put it in here? Oh, wait, no.
No.
Want to lift up on it and kind of see what you think you're at first of all.
Okay, I think this might be.
What do you think that is going to be? Small or large intestines?
I think this is the small intestine.
Okay,
And
so
this
then
might be the large intestine.
trace it down to where if that's the small, then trace it down to where it would be the large. Because remember, the large is going to be attached to the small.
Right?
No?
So I think that might be the large intestine.
Oh.
Right.
This is the small intestine.
Okay.
Yeah.
And then where's the
And so the small is going to be attaching to the large at the ilium. So
Which is
So
the
I'm trying to
bottom.
look for the. I'm trying to follow the large intestine too. Oh,
It's just deflated.
so this is not. This is the large intestine.
No, that's the small intestine. Small.
That's
Large
the
is like
large.
opposite.
you got it.
I'm trying to like follow it down. I guess I'll be.
You will. You eventually, as you dissect in there, you're not gonna be. It's you got to
Oh,
separate it. So don't worry. You got at least you got the right organs now.
Dr. T, do you want us to cut into this muscle? Because we're not seeing organs.
Well, you're gonna just keep on going down.
Just want us to pull
Yeah. Now eventually, try to get us pick up and start getting used to. Because somebody's gonna ask you to assist in this. So try to do this and hold back or retract from her, and then you can go deeper now. Try to, as you're cutting, cut it along the sides. I mean, cut inward so you don't go straight down with the blade.
So keep on going like out, right?
Yeah. Now you got the superficial layer off. So know where you're at.
I would just be real careful.
Isolate more and more.
Yeah, that's
But how far to the side should we go though? Like,
Okay, so keep on doing like you're doing. Cut along the margins. That's good. You want to isolate as much as you can. You don't need that excessive on. That's not what you're looking for. You're going to be going in the abdominal cavity.
the pig's on this. It's
Got better. Do you feel comfortable holding like that? I mean, you feel like you got control. You hold like a pencil. You got. All right. So now you want to get into the abdominal cavity. You're isolating this area of the abdominal area. So what kind of, how are you going to open that up now? And there's going to be something that's going to separate the abdominal from the thoracic cavity. And what's that going to be, that structure? It's going to be the diaphragm.
From the kidneys.
So I want you to, if you want to get in the abdominal, I want you to stay away from the thoracic. There's no abdominal areas in this area here. All you're going to be able to see is maybe the esophagus coming through the diaphragm.
Liver.
So go ahead, just do a sagittal cut right down the center. Yeah.
Where is it
Find
going?
his goal.
It's right. It should be. Yeah. Is it below the liver?
cool.
That's normally where it would lie, right? Interesting to see that myself. Yeah.
That's a good little spread. There's a good little spread.
Okay, see? You're getting to the intestines. You need any better
That's the
flush
stomach,
for you or
right?
dry suction?
Do we have one?
Yeah, you got the syringe. You would fill that up with some saline or suction it out if you want. Wow.
I know. Yeah. Anesthesia, can you raise the bed, please?
Nice.
Can't find the gallbladder.
Do pigs have gallbladders?
They do, but the
very small.
gallbladder is behind the liver.
Behind it.
So look for a
Behind the
sac.
liver.
Look underneath the liver, and you'll see a sac that should look green, and that's going to be your gallbladder.
Can we take the liver out? Just to,
Just throw it in the sink if you want to. You're suctioning out the area.
Oh, cool, look at that. That's where, yeah, well, just from the stomach to where,
the duodenum?
I believe so.
Nice.
Yeah.
Now
So that's
you're going to
the
go up
upper
into
lowers
the
and then
abdominal
to the
cavity.
duodenum right there.
Let me get you some papers. And as you start opening the cavity, if you get fluid coming
That
out,
can't be it.
there's
The liver
syringes
is-
suction
where's
it
the
out.
It's all right.
So you try to keep it from flowing all over the place.
But typically,
Deflated?
I see right there. See it right there. See right there. See that little deflated little thing? No. Not right there. That little. Ooh. I touched it. I touched it. No. Yeah, I believe that's because it's normally under the inferior part of the liver. It's under the bed of the liver. Yeah, but it's probably all deflated out now.
Yeah, absolutely. You want to do it? You want me to do it? Or no, you want breakfast?
Did we get it open?
We
see organs.
On the sides, we get more access to the side.
Yeah, good idea.
So you're
You want to flap that back.
So, you see where that cut?
Do I just keep putting them down?
Just follow that cut all the way around.
Kim's freaking out.
Do I just keep cutting around it?
Yeah, so what you want to do, what you want to try to do is get the cavity open. So you got that open. So make your way up this way, and then just expand it open. You might have to crack it open a little bit, just what it
That'll
is.
suck
But,
it out.
something called a component separation. He's trying to have you do the layers, but first you got to get through the initial sternum, what have you. Yeah, you might have to do a little. In the real world, if you're doing like a chest cavity, you're going to use a saw, but in this case, we can't do that. But,
Normally they just put it down the same.
do you feel bone there?
Yeah, this is all bone right
Yeah,
here, but
go
then this
ahead.
is like the muscle.
Yeah, so go around. There's cartilage. There's that cartilage in between the ribs, so maybe you can just separate one and then just split the sternum off to the side, since you can't get through it. Yeah, exactly. But maybe you try coming upwards instead of down. Exactly. So you don't. I mean, so there's something called a good rule of thumb. And this is called a ribbon or a
Nice.
malleable. Obviously, it's a knife handle, but if it was, what they can do is put that underneath.
So you don't.
You're, there you go. Right. So if you, God forbid, you're cutting, you're not going to perforate. This is actually going to protect.
It's
As you're
vessel,
cutting,
it's
it's going
going
to
to be
hit this.
aluminum inside. If
So
it's
use
not,
that as a
it's
kind of a
fibrous, it
protector.
could be a no.
And they do that with
It looks
malleables,
like it's probably a
especially when
nerve,
they're
because there's no. If you were to probe inside there, you wouldn't see a hole.
I think it's the it's the.
And if you need
You can cut it.
I was
Yeah,
thinking
cut
about
the rib.
breaking it, just like.
Yeah, go ahead.
see intestines,
Oh, it won't even. Yeah. There.
you just can't get through the top part. Yeah.
No, because the
Ribs. I was telling them maybe you can go around the cartilage, cut that there a little bit, and then you can just split it off to the side. Well, off to the side is the cartilage along the rib, so you probably can cut through that. And
So you got your hands on one.
and then you can try to open up so you can see the thoracic cavity.
There's every time the gallbladder. Bacon in there.
And he got some food out of it.
Crazy. He's doing a gastrectomy. What is that?
And now that's just.
Can we send that down to the lab? Or?
Someone was saying.
What's this say?
I feel so bad for this little guy.
Well, I put water.
Let's get the fluid out of here.
Sample.
So you went over the digestive system, Dr. T?
We did most of, we went through the main part of it. Now we just have nutrition left. Okay, so what do you got there? What organ?
This is the liver right here.
Okay, so can you lift it up so you see underneath it? And I want you to find the gallbladder.
That's a big liver on you, man.
This one is a stomach, I believe. On this side. But yeah.
Okay, good. You're using your blades more than trying to push things apart with your fingers. Good. Nice.
Can I stitch this something back up? Or no?
Yeah, give it a try. You're the doctor.
What else can I do?
No, what do you have
You want
him
to
give
free
you
it
a
up.
suture
You
like
want to
you
lift
do in
it
the real
up.
world?
Then
You're
see
the
if you
tech.
need to.
That'd be the last thing you would do before you are escorted off the property.
This is called
Well, you're eventually going to close the
Midterm
cavity.
people.
I would use these interrupted.
paracentesis. Centesis
Like
is
a personal
suctioning
vertical
things
mattress or
out,
something
fluid
like
from
that.
something. You're taking fluid out of the
Heart?
abdominal cavity.
This pig does have a heart. Did you cut into it? How many chambers are the heart? I don't know. There's 2 chambers. He's an alien pig. Does a pig have 4 chambers, Dr. T? Or is
Yes. Who said 2?
it no one? I was just curious if it's identical to humans. No, it's 4 chambers for a heart. Atrium and ventricles.
Nice. So you're freeing up that
I
liver.
love the heart.
So how many lobes can you see on the right side?
It's
2 or 3?
Or is it? Yeah, the lungs are on the side,
Three lobes
and that's
to
in
the right,
the pleural
2 lobes to
cavity,
the
right? And that's controlled by a negative pressure.
And then see if you can lift it up. If you can free up underneath it, you'll see a green sac and that's where the gallbladder.
Okay, and then you said they're normal?
Just like a normal.
Nice, nicely done.
Anyone else want to try cut?
Someone have the scissors ready for her?
She's gonna do a run.
When
So she's locking it and running it.
like you pick it up and then it goes in?
Okay, so do your waist stitch.
Oh.
Yeah, so you're gonna anchor it like a normal stitch. So now, oh, I'm not doing any of it. Alright, so run your normal stitch.
Oh, again, like this?
Yep, just a little bit next to it. So you want even separation.
You can cut that excess thread off too.
You started about right there. So just come to an even distance from that. Okay, so just come back across, stitch, back across, all the way down. And then the anchor that you did here is going to be the exact same anchor you do.
But use the other Atson for the other side. But when you come through, relock it up again right there and then. Don't come up again. So as it comes through, just redo it, just clicking. So it saves you time. So as you're coming through, just click right onto it.
When he's saying all he's saying is whenever you put the needle through, let go on this side and grab on that side.
Oh, okay.
Yeah, you don't have to tie anything. Correct, that's what you're saying.
Yeah, it's speed. And I know that's, you should have an Atson in your hand and the other one too. If you have an Atson in your teeth.
So that's a paracentesis.
Otherwise, you're going to stab
If
yourself.
you aspirate the thoracic cavity, that's called the thoracentesis. Centesis is taking fluid
So you
out.
grab it. So as it grab it, pull it through a little bit. Now
Amniocentesis
clip
is
right on.
taking
Go to back.
some
Clip right
fluid.
onto it.
Wait, what is it?
So
Just click. Just click. So you're ready to go for the next one. And now, and then you would say, "Hey, Travis, can you follow for me?"
Can you follow for me, Travis?
And just pull it. And just
And then there I will start again.
exactly. Right. And you're working as a team with
And
that.
how do I do this? Like,
Travis,
say this
sir.
is the end.
So
Nice.
we'll say this is the end of it.
Look how nice and clean those organs now. You don't see any slits or cuts through
So come to this side.
them. The guys did a great job.
Well, I learned the anatomy of a pig, very similar to the anatomy of a human, especially in the digestive system. They have similar systems that we do. What else did I learn?
Can you tell me how many small pieces of small bowel we have?
How many pieces?
Yeah. What is the names of those?
Small bowel.
Put you on the spot.
I know you definitely did. I know there's three. You have the ileum, the two other ones that are really hard to pronounce. I'm gonna butcher, but hey, phone a friend.
Are you? So, tell me what you learned about this surgery. Speak into the mic because.
This is supposed to be a me and Travis kind of
Oh,
thing.
Travis
He was
did
phoning
that.
a friend.
Okay, here we go. I got one of them.
Which one did you get?
I got the ileum. Need the ileum.
And then duodenum. That's how you say it, right?
duodenum.
And then the jejunum.
That is absolutely correct.
And then the duodenum is the first one.
What connects to the? What's the first part of the large bowel?
The first part of the large bowel.
Yeah, you got me.
I know
right
the
there.
appendix is
There you
connected
go.
to it.
Okay, it is.
The
Oh.
actual name of it. I can't.
What was the?
Starts with a C.
I know where it's at.
Oh, the cecum.
Cecum.
There we
That
go.
is correct. You're next.
Perfect. On the spot. Yeah.
Just get up there and tell me what you learned. Something.
Your
I'm not
turn.
leaving it until you do.
I learned that the digestive system breaks down food into nutrients.
Well done. Good job.
That is
Yeah.
correct.
That's the only thing I can remember right now.
All right. You learn in this whole approach. Can you tell me something about the digestive system?
Hey Mel, did you like that?
I did the vertical stitch.
Nice.
I think I did really good.
Did you have fun?
I did.
Yeah. Right. Do you like these kind of dissections?
Yeah. I don't like the baby pig, but
What would you like to see in dissection? Cats?
no.
Yes, I want to see a cow.
All the,
A cow
all the
or a horse. Oh, a cow
Dr.
would
T,
be
can
pretty
you get a whole
fun.
cow in here?
Yes. Or a sheep, a big sheep. I'd want to like skin the sheep.
Yes, but make sure you wet them.
Yes, sorry dear.
Wet the towels. Yeah.
Alright, I learned how to start or kind of do a running interrupted stitching where it's underneath the sub layer so that way it's more hidden.
Did you? The pig didn't make it?
Oh, no, not something about the pig, but what I learned about the digestive system.
Yeah, let me hear it.
Okay, so what I learned about the digestive system is that the hypothalamus has like two centers. One is the hunger center, and one is the full center. I guess that's what we learned. And the ruggy or ruggi, I don't know how to pronounce it.
Yeah, the rui and the stomach.
Yeah, so it basically stretches to let the hypothalamus know that the stomach is full. So it will send like messages to the brain saying that we're full, do not eat no more.
Huh. I
Yeah.
never knew that. I've learned something right now.
Yeah.
So it's stretching it, there's a signal going saying, hey, you know, I'm full.
Yeah, don't eat anymore.
I wonder what
And
nerve that is.
the nerve?
Is that a cranial nerve? Interesting. I have to look that up myself. There's 12 cranial nerves. Probably we should know that. Is that
Dang, I don't remember.
Go ahead, dear.
I don't remember. For when the stomach is hungry, I know that it releases a hormone or
Sorry, I'm finishing up that scooter.
an enzyme called like leptin.
That's right.
Yeah,
Did you learn that today?
yeah, I learned that today.
I'm impressed. Most people don't retain that.
Yeah, and then I don't know what the other one is. It's the G one. It's like Jilrin or something like that. When the stomach is full. It's like a.
You guys are beyond me.
Here for a whole.
Dr. T, here's Mike. Finish it up, sir. This is your show. You have your students here?
Yeah, I have all my students here. These are AP for the Surg Tech students. I'm proud of all of them. I mean, we just started dissecting maybe 2 or 3 weeks ago, and they're doing a complete fetal pig with all the different systems, and we're breaking it down. And they want more and more. They want to learn how to suturing. They want to put in staples or isolating organs. So we're really we're learning a lot here. We're learning a lot in AP.
What was that? Come up here to the mic. Tell us a little bit about what you're saying. Since you're. What just happened?
I got a $25 gift card to Walmart.
For what?
Perfect attendance.
All right.
Be like me. Woo-hoo.